That's
All
what's
right, we're
happening.
going live.
All right.
Good morning, everybody.
Good morning.
Good morning.
Are we able to see how many people are on, Michael?
We're live.
All right.
Good morning, everybody.
Good morning.
Good morning.
All right. Just want to make sure that it doesn't repeat.
All right.
Yeah. All right. I should be able to close out of the Instagram. All right. Okay, everybody. Well, thank you so much for joining us. This is our first community call of 2025. Welcome. Can you not hear us? See,
I can hear you.
Okay, everybody. Well, thank you so much for joining us. This is our, we're going to have to close that. All right, so we're just going to go here. Yeah. All right, so I'm Michael Barnett, Partnerships Manager for Dharma Doctor, and I'll be introducing our speakers today. So joining us, we have our founder and CEO, Brad Mosell, who's leading Dharma Doctor's vision and innovation in the therapeutic and mental health space. Also joining us is Dr. Amy Serin, Chief Clinical Advisor to Dharma Doctor. Dr. Serin is an internationally recognized neuropsychologist and stress expert, best-selling author of The Stress Switch, and founder of the Serin Centers. Dr. Serin is the clinical mind behind Touchpoints, and her ongoing expertise and research in this space has been fundamental to our approach. So today's session will focus on remote therapy. We'll start with a 20-minute overview of features and practical tips, followed by an extended Q&A session. So we'll be doing 40 minutes for our Q&A today. And please go ahead and enter your questions into the chat throughout the conversation, and we'll go ahead and get started.
Well, good morning, everybody. Thank you all for joining us. So glad you're here. I just want to start off, talk a little bit about Dharma Doctor, a little bit of the overview. You know, Dharma Doctor was started 3 years ago, and our mission is really to outfit the world for the journey within by inspiring hope and building the most accessible and effective tools for stress reduction and memory reprocessing. I'm assuming a lot of you work as clinicians in the mental health space. Many of you may have not had any experience with EMDR or with bilateral stimulation and are just looking to learn more. But that's our goal, is to always make these tools more accessible and more effective for anybody utilizing bilateral stimulation in any sort of mental health protocol. So we started the company 3 years ago, but we launched the beta product in May of this last year. And for the last 6 months, we've been doing beta testing with users. We've got over at this point 1,400 therapists utilizing the tabs throughout the United States, and the results and feedback have been amazing. One of the features that we really wanted to focus on, though, early was the enabling of telehealth. With COVID being full swing when we started the company, the ability to provide tactile bilateral stimulation remotely was a critical element to what we wanted to build. And so the solution, we think, is fairly elegant, fairly simple. But I just wanted to show everybody, in case you didn't have familiarity with how to use that inside the app. So the app today, for most cases, you open up the screen and it looks like this. This is the tab control screen. It connects directly to the tabs. And so if you were in person, you would control the tabs just using that screen. And you can start, stop, change speed, change the intensity of the tabs. You also have the ability to count the number of sets. You have a timer to say how long you've been going. In the next app release, we will have the ability to preset a auto stop function. So it'll stop after a certain number of sets or after a certain amount of time, enabling you to kind of have those auto stop abilities. The other thing we can do with the app is you can utilize it for audio. So you can turn on audio BLS, which syncs with your headphones. So you'll have left, right, bilateral stimulation that goes along with the visual and the tactile of the tabs. But from here, we also can go down to this More button. And there's some features, but the second one down is remote access. And so when you click remote access, it gives us these two options. It says to generate a code or to enter a code. If you're a therapist or you want to be the controller, you're going to hit generate code. So I'm just going to hit generate code here. And immediately I'm prompted with this screen where it tells me this code, and I say continue. So my code is 2282. And I'll hit continue. It says, all right, and my screen becomes the control, and it says 2282. And Michael over here has gone ahead and gone through the enter code screen. She entered 2282, and it shows that she's now connected. And as you can see, my controls are active and hers are not, which means that I now can start and control Michael's tabs remotely. I can change the intensity. I can also change the speed of alternation. And we can have a full tactile bilateral stimulation session from anywhere in the world. So right now I'm in Boise, Idaho, and Michael is in Virginia. Is that correct?
Charlottesville, Virginia.
In Charlottesville, Virginia, and we're able to control these tabs entirely remotely. The other really interesting feature that this enables, and we'll talk a little bit more about this, is it also enables group controls. So if multiple clients wanted to enter that code, they can. So there are a couple different group EMDR protocols that are being utilized now, especially for natural disasters. So if multiple people have the client or have the tabs, a single therapist could walk them through those group protocols and lead decentralized group reprocessing exercises. With things like the wildfires in LA right now, this ability to treat larger numbers of people scalably is of the forefront of need. And so we're also really looking for therapists that want to explore and want to pursue that sort of growth. That feature, we can change. You can control just the speed, so clients have the ability to control intensity. We give clients the ability to start and stop independently. There's lots of flexibility there, but it's a feature that we're really excited about and can't wait to see utilized across the world. But that's really it. It's this very simple access to exit. You just press this top button. It'll say exit control mode. I'll hit exit. It breaks me off, and then Michael's phone also disconnects automatically, so she's no longer connected to the control, and it's that simple. We have, this bilateral stimulation in the tactile way, in a way that really has never been done before. It can be done entirely mobile, so people can utilize it wherever they are without needing a desktop app. There are other apps out there like bilateralstimulation.io. It uses a tactile wired device that connects to your computer, but this makes mobile therapy possible and can be used, more broadly. So that's my sort of side on the technical elements and the vision of what we're building. We're going to talk a little bit now. We're going to have Dr. Serin talk a little bit about the benefits of tactile bilateral stimulation and why that's important from a telehealth perspective.
Thanks, Brad, and well done. I'm really excited about all these features, especially the auto stop function too, remotely. I mean, that's really great. When I'm training new therapists, one of the questions they're always saying is, how long do we go with the stimulation? And so that's a really nice feature that you're going to add in there. So the benefits of tactile stimulation, I think, go way beyond what we're trained in as EMDR therapists. And if you're a therapist or someone who's not EMDR trained, that's okay too. We'll kind of go through the basics of it. I think it's important to know that some of what EMDR therapists are trained in does not necessarily reflect the recent research and the EEG studies about what tactile stimulation does. I think because it's been used in the context of creating a calm and safe place, and then also in phase 4 of EMDR therapy, where you're actually processing trauma, there's a fear that using bilateral stimulation may somehow flood someone or create dissociation or some kind of an abreaction. And the tactile stimulation is not the thing that creates that. It's within the context of reprocessing traumatic memories and emotional memories. That's the thing that is really the trigger. Tactile stimulation on its own, outside of therapy, we've shown on EEG, reduces the stress response. And it does it very quickly and in real time. So aside from therapy, we want to be using tactile stimulation whenever we're feeling stressed out, to help calm our children down, to help a friend who's going through a tough time, to help anyone who's just feeling stress in every moment. So we're very underutilizing it outside of the therapy context, and we're actually underutilizing it inside the therapy context. So the published research is a 62% reduction in stress in 30 seconds with bilateral tactile stimulation. There's no other technology that I have found that does it that quickly and that profoundly. When we're looking even at vagus nerve stimulation, it takes a lot longer. When we're looking at unilateral stimulation that's tactile, it takes a lot longer. And the percentage of people that experience a stress response without the risk of an abreaction is the lowest with this kind of technology. So really, really important that it does some profound things. It can be used safely inside and outside of session. And now I want to talk a little bit about how to use it in teletherapy sessions, because a lot of teletherapists use eye movements for phase 4 processing. They're not using tactile. And I stopped using just eye movements in EMDR processing probably about 10 years ago, because I noticed before I even started doing research that my patients who were just doing eye movements, they were getting more flooded. They were getting more heightened. Their anxiety and their fear systems were activated for longer before they got that symptom relief, and their subjective units of distress started going down. So I noticed that just pairing the eye movements with tactile stim actually gave my patients a better, faster response. So I'm noticing in teletherapy, a lot of therapists are using just eye movements. And some therapists are even afraid to do teletherapy because of that fear. Like there's something that's maybe a little fearful for therapists. Like, okay, if my person I'm doing therapy with is not in my office, right, and they have an abreaction or something happens, I'm actually not physically there to problem solve. And using the tactile stimulation can actually help reassure you and help you with your own anxiety about this, because your patient will actually have access to something that can reduce stress outside of session. So typically we will do a history session on teletherapy, then we'll ship someone the tabs, and then we will have them use the tabs in our next session. And the other thing that we do is we actually expand the use outside of phase 4 processing and outside of just doing calm, safe place. In other words, I have my patients hold them the entire time they're talking. And then when we do phase 4 processing, you'll notice the tabs blink back and forth. And so I have them either hold them on their laps, or if they've got if they can do that on their chair, and they can look side to side as the tabs blink in conjunction with that, or they can pick 2 points in the room and they can move their eyes with the rhythm of the tabs while we're doing active processing. Then the question is, what do you notice? And then they tell me as they stop doing eye movements, and then we add the eye movements back in. So the eye movements we're going in and out of, but the tabs are on the entire session. And the benefit of this, and we know this from some EEG research that I haven't published, is that they're getting stress relief whenever the tabs are on. And that's key. The only time that isn't necessarily true is if someone's trying to focus or do something and there's a lot of competing stimuli, like if there's music on in the background and it's loud and someone's trying to do homework and then they put the tabs on, they calm them down, and then after a certain period of time, they might say, these actually feel a little distracting now, I'm going to turn those off. But in the therapy setting, it's very rare that someone would feel any agitation from prolonged use of the tabs, and they're getting that stress relief the entire time. Now, if you're in person with someone, what we do is we actually have them use the tabs in the first history taking session, because they're bringing up all kinds of traumatic and emotional content, and they're actually getting a stress relief, and they're getting more of a treatment in that first history taking session, rather than just having them opening up all these things and then trying to kind of, close them down with a breathing exercise or something at the end. It doesn't work as well. So those are just some of the uses and how we're doing these things in teletherapy and in person, in an expanded way that can help our clients get better faster. And I'm sure we're going to have a lot of questions about that, because I'm turning some things, on their head. But I would never just do eye movements in a teletherapy session.
Perfect. Yeah, I mean, one of the other interesting things, I know a lot of therapists working in teletherapy, they also use the butterfly hug, right, as a go-to sort of how can I provide tactile stimulation remotely. And there's a lot of evidence indicating that self-administered bilateral stimulation can be less effective
Yes.
than having tactile stimulation that's administered via a remote apparatus or remote device. So
Yeah.
that's another one of those
It,
improvements that we're
yeah,
making.
and it's a really important distinction. I know therapists tell people, oh, I want, go ahead and take a walk because that's bilateral stimulation because you're walking. And there's a big distinction here between volitional movement um, and self-induced stimulation and outside induced stimulation. And the types of stimulation matter as well. So we know that hard taps are not as effective as smooth vibrations. And this has to do with the brain and how it processes sensory information. And I always get the question of why. I don't know why. I'm not sure. All I can say is that the response is different, and has to do with the way the brain processes sensory information. It's kind of like, why someone would prefer a certain kind of music to other. And there's sort of a general type of music that most people would respond favorably to in terms of their sensory network versus something else. But the bilateral nature of the stimulation has power, and the type of stimulation has power, and the rhythm of the stimulation has a lot of power. And if we ignore any one of those things, or if we do something that's less effective, we're not going to get what we want. Certainly the butterfly hug is better than nothing. It's better than trying to control your thoughts when you're flooded. So when we look at, there's a hierarchy of what we can do based on what we have access to. And we want to use the butterfly hug in situations where we don't have tabs available, but we want to acknowledge that the technology in the tabs has a superior effect to a lot of the methods that we've been using.
For sure. Well, with that, let's go ahead and move over to some questions. Michael, I know you had some early questions that we wanted to go over. So
Yes. Excuse me. Yes, we actually had a few pre-submit questions. So I want to make sure that we cover. And thank you to everybody who did pre-submit your questions today. Our first question is, have you explored integrating biometric feedback from smartwatches or other devices to help therapists monitor client stress levels during remote sessions?
so the answer to this one is a definitive yes. And Dr. Serin has done a lot of EEG research utilizing the bilateral stimulation and can show some of those results. But just recently, I was at CES, the Consumer Electronics Show, and there were a couple new devices on the market. We had Muse 2, which is a consumer EEG device, and Neurable, which is a new consumer headphone set that also pulls EEG scans. And let me see if I can find these graphics because they're fairly stunning. Both of the devices showed a dramatic reduction in stress in focus, or a dramatic improvement in focus when we were utilizing the bilateral stimulation. So here's one actually. So this is Neurable's new display. And the yellow shows low focus. So this was without the tabs. And then the blue and the purple is when the individual was actually holding the tabs. So this is a consumer EEG feedback mechanism utilizing the bilateral stimulation and showing the actual change in brain activity real time. We're exploring a partnership with Neurable so that someday that will be integrated directly into the Dharma Doctor app, and we'll be able to utilize that for in-session feedback. But very, very exciting stuff.
Yeah.
Dr. Serin can talk a little more about the EEGs in general.
Yeah, so I think there's the EEG monitoring, and then I think there's also a lot of opportunity for just the sensors in partnering in technology in terms of the stress measures that smartwatches and things like that are already measuring. We do want to close the loop. So the marketplace has been saturated a lot with measuring. There's a million ways to measure your stress and measure your sleep and do this. And then it's like, okay, but now what? So the tabs are actually treating this and changing your physiology and your brain and, all of these things. And then the outcome is better stress, better, more calm, more focus, more awareness, more higher order thinking, fewer cognitive, problems, things like that. All of those things have already been shown. And then the next step, right, is to expand the user's ability to know what this is really doing and to move beyond that. We did do a study with bilateral stimulation years ago with Pearson's quotient. They've discontinued this, but it was an ADHD test similar to the IVA or the TOVA for clinicians. And we did find in about 60% of the patients with ADHD, these were children and adolescents, it significantly improved their focus and their hyperactive movement. The quotient was cool. You put something here and you could just track people's movement. And so there'd be all these squiggly lines of how much they moved without bilateral stim, and then how much they did. It was beautiful. But the focus is interesting because a lot of people think focus is just attention, but focus is modulated by stress and anxiety. And so it makes sense that you're going to get, people ask me, will it help with this? Will it help with that? Will it help with this? Yes. When you regulate the nervous system, all the higher order functions are better, and you put somebody in a state where their humanity can come through, right? Their kindness, their focus, their ability to be reasonable. If you think about fighting with somebody or being really angry and kind of how you are in that state versus when you're calm, we really want to restore people to that state as much as possible, and that will have huge effects. So it's really exciting that the ability to measure now is being democratized, like with Neurable and Muse2 and some other devices on the market, rather than everybody having to come into my clinic and get a 19-channel EEG that's expensive and takes about an hour. So really exciting times here.
Yeah, and we expect to have most of those integrations at least initially launched sometime within the year. That's the hope.
All right. Next, we have, given the device's portability, have you explored partnerships with humanitarian organizations for crisis response? I'm curious about the potential for AI assistance in protocol selection. Are you exploring ways to help therapists optimize treatment plans based on client presentation and response patterns?
So it sounds to me like that's kind of two different questions,
Yes.
and I'll chunk it in apart. The first is we would love to. We have spoken to a couple people from the EMDR Humanitarian Assistance Program, HAP. We've had limited supply of tabs right now, but as we continue to get more, we really, really would love to work with any of the humanitarian organizations, especially those doing group therapy for large populations. So especially right now with the situation in LA, if anybody is involved in any sort of group protocols or intervention for the population, please reach out. We would love to explore and help in any way that we can. So yeah, at a high level, that's very important to us, and it's a major goal of Dharma Doctor. The next question is about AI assistance and protocol selection. We are exploring ways to utilize AI that will make make practice more effective. That's still very much in a beta phase, and so it's still sort of to be determined. Our belief is that AI could be effective in helping identify the correct speed and intensity by watching some of those EEG patterns and the heart rate variability, and seeing effectiveness across all treatment modalities. That's probably where we think this will first and initially be utilized.
Brad, can I say something about selecting the right frequencies and everything? Is that we'll have emails and some trainings and things like that. We already have a method of how to do that qualitatively from patient feedback on how much their SUD and their body sensation are reducing, because this works very quickly. So we already do have an algorithm to start with that we can share. of how you can determine that for your patients of which intensity and speed is working best. And there's research to suggest that the qualitative reporting of the SUD and the body sensation and the reduction of that is correlated with actual changes in EEG patterns and things. So in other words, we can trust someone when they say, okay, I was an 8 and now I'm down to a 4, and we can use that in the meantime.
All right, next we have the remote therapy landscape is evolving rapidly. How do you envision your platform adapting to incorporate emerging best practices in telehealth? Are there features on your roadmap that particularly excite your team?
Well, yes. The answer to the question is yes. We will continue to build out features to support the telehealth landscape. Inside the app, there's a feedback page that enables all users to post requests for features or improvements that they would like to see in the app. And we do our best to utilize that to help drive our roadmap forward. So building the product and building the company is really a collaborative process with all of those users. We want to be responsive, and we want to drive those features forward based on that feedback and based on the requests. Things like the countdown timer and the auto stop function are all coming directly out of these user requests, and we expand based on that. Now, in the long term, or in the semi-immediate term, we're really excited about incorporating the neurofeedback, heart rate, and heart rate variability from all of these devices. We think that really closes the loop, as Dr. Amy Serin talked about. So we're stoked to begin bringing that into the ecosystem and providing that visibility. We're also really excited about expanding some of the integrations and some of the content within the app. We think that there's this space to provide additional content around all sorts of exercises and all sorts of feedback. So we're working with a bunch of different therapists to create and to provide some of that content, and hopefully that'll be released throughout the course of the years to come. But at this point, that's kind of what we'll those are the most exciting things in the immediate future.
All right. From Lucia, we have, how are clinicians handling the purchase of Dharma Dr tabs for remote clients? Do you request your clients purchase them privately? I wonder if a health savings account could be used to purchase them.
So currently, we are not HSA eligible. However, we hope to be soon. That is something that we're working on. So soon clients will be able to purchase with FSA, HSA accounts. Therapists are handling it differently. Some therapists are purchasing them and then giving them or sending them directly to the clients and then getting them back after session. Others are recommending that clients purchase them independently. We support clinicians and clients by providing custom discount codes. If you're a clinician that wants your clients to use these, we can provide a discount code that you can share with your clients so that they can get them at a discounted rate. So that's one means of partnership that we offer for all clinicians in the space in order to make it more accessible to the clients. But right now, those are kind of the two ways in which clinicians are making the tabs accessible to clients.
When we try to lend them out for teletherapy, no one wanted to send them back. So if we're having our clients use them outside of session to help them fall asleep faster, or to mitigate stressful situations, or to de-stress themselves before a presentation, or there's so many different uses for these outside of the office that we tried to say, well, we don't want to add an expense, so we can just have you use these and send them back and put a deposit down, something like that. And then no one ends up sending them back. So we don't do that anymore. We just typically we keep stock on hand so that immediately we have demo sets in our clinic that all of our therapists can use, so that when people are in person, they can get that stress relief from the tabs in the first session. and we can introduce the tabs in the first session. And then we typically have them take a set home. And then if they're going to follow up on teletherapy, they have it for teletherapy. And even if they come back in the office and use our demo sets, we want them using them in between the office because it greatly accelerates their healing process.
All right. For our next question, we have, what's the best way to clean the pulsars between clients?
Great question. Two answers. The first, you can clean them with any household cleaner. It's medical grade silicone. So you can use hot water. You can use like a Lysol wipe, whatever typical cleaner that you would normally use to clean down some sort of shared surface. That's the best way to go. The second interesting feature about the tabs is that the silicone sleeves are actually removable. You can change them out. So if your silicone sleeves are starting to get worn, let me just show you. So I have these tabs. If, over time the silicone does get worn through years, we can actually take them off like so and replace the silicone itself so that it's refurbished and ready to go. So if you ever need new silicone sleeves, please let us know. We're happy to send you a new set.
Okay, let's see here.
I didn't know that. That's great. I had a client the other day that was really nervous, and therapists are going to laugh because they all know this. They grip them, they pull them apart. And he was like pulling on the silicone, and I thought, oh no, is this going to do that? So that's great. That's new information, and that's great to know.
Someday soon, you'll be able to buy all the silicones in different colors too. We'll have
cool. I can't wait
for customization.
All right. Is there a level on the tabs we're trying to work ourselves or clients up to, or does it not matter? Yeah, maybe we could speak to the different settings as well.
Yeah. So more is not necessarily better. This does not have a training effect like weightlifting, where you start off with 5 pounds, then you go to 10, then you go to 15. The correct level for the patient in the moment is the level that feels good and is reducing their subjective unit disturbance approximately 50 or more % in 30 seconds. That's what we're looking for. So most people will respond to the blue setting. That's pre-programmed in the Dharma Doctors already. And by most, I mean maybe 70 to 80%. If that does not produce significant reduction in disturbance, then we change the intensity and then we change the speed. And again, we have an algorithm for how to go through this. But what we're really looking for is what frequency and intensity is your client in that moment responding to the most? What's giving them the most stress relief? And if they're extremely angry or intense or panicking, sometimes the pink purple setting is the best. But typically that's used for people who are very fast processing speed, or they're in a very intense situation. And then for other situations, someone who responds on blue for normal stress relief, if they're trying to go to sleep at night, they may prefer green. So there's kind of a testing that's going on. If you are using eye movements with the tabs, most people will use the blue setting for that. Green may be okay, but it may not be enough to activate some of the trauma. It may just have a calming event. So you might find if you're doing eye movements with green with clients, they may not really kind of get into the access of it. And then if you change it to blue, then they might start accessing what they need to be able to reprocess it. The pink, fuchsia, I don't know what we're calling that color, Brad, but purple, whatever the fast one is. What's fuchsia? Okay, we'll be sure. It's fuchsia. So the fuchsia setting may be too fast for people to do the eye movements with it. So if you're in phase 4 active reprocessing and you're adding eye movements, that may be a little fast, even if someone prefers it.
All right. We have somebody asking, where does the name Dharma Doctor come from?
Oh, sure. So I, prior to starting the company, was a practitioner of Theravada Buddhism. And this idea of Dharma, it comes from a couple different spiritual traditions, but it's the idea of universal truth, the divine truth. And when we think about trauma healing, it's like what blocks us from seeing the truth? It's our perceptions, it's the, it's the karma, it's the things that have, blocked us from experiencing that through our own lived, history. It's trauma. Um, and so the experience of EMDR for me as a client was one of clearing away some of that blockage, right? So that I could see the world and experience in the world as it is, and not how I was projecting my own, my own trauma onto the world. Um, and so Dharma Doctor as a name is sort of this bridging of both the Eastern and Western philosophies of getting to this idea of like, we clear away the perception and we clear away those things that block us so that we can experience the world more fully, and building tools to support that. So it's kind of this web. Also, DR is like EMDR. There's some alignment there as well. But
It's a great
Right,
question.
yeah, and I love that because EMDR therapists know that when you clear trauma for people, that's when their humanity emerges, right? And I had someone tell me a while ago, and I thought this just really hit home. He said, I think your job, Amy, in this world is to de-stress people so that they can remember that they're kind. And I just thought, oh, that's a great way to say that moment that EMDR therapists get to when their clients transcend the trauma. And when they transcend trauma, what emerges is so beautiful. It's all the love and the light and the goodness of humanity. And then that's what's present and foremost. It's not covered up. It's not adulterated by all of this crud that we're walking around with. It's unconsciously polluting our psyche. So that's really beautiful. I'm glad I'm grateful for that question and for your answer.
Me too. All right, let's see what we have next here. Are there any complications with using the same device for both the teletherapy app and the Tabs control app? This is from Joey Davis. Thank you, Joey Davis.
So when you're using the app, you cannot control local tabs and remote tabs simultaneously. When you become the remote controller, you can only control tabs that are not local right now. But there's no complications in using that device. I guess the tabs are designed to be used by one person at a time. So there are you do have to go through a process to reset them up to pair with a new phone. If you're like handing them around or passing them to other people, it can be done. And it's not particularly difficult, but there is a step process for that. But if you have your tabs locally and you have them connected to your app, and then you want to use that app to control remotely, there's no complications there. You just won't be connected to your local tabs when you're controlling somebody else's remotely. Hopefully that answers the question. If you need more specific guidance around any of that, please feel free to email us. We're happy to handle more detailed support.
All right, and our next question is from Brianna Nicholas. Given the tabs were seen to improve not only the stress response, but also the performance in ADHD patients, would you classify these as being overall a nervous system regulation tool? Do you have plans to explore their efficacy with other modalities that work in the field of mind-body regulation? For example, primitive reflex integration in children to enhance learning readiness levels, or academic and behavioral challenges? Great question.
Yeah. So yes, they regulate nervous system activity. So the salience network in the brain is the sort of the filter and the decider. It integrates all sensory information outside and inside and decides what to do with the stress switch. And it helps with what to do with attention and, all of these things. So the answer to all of this is yes. We think of things as like dichotomous, and so if something's regulating the nervous system and regulating the stress switch, it's also regulating all essential functions and higher order functions in the brain. Because as you work up to fight or flight, your body works up to it. What happens is all non-essential things for survival shut down. Higher order thinking, access to memory, executive functions, everything that basically separates us from animals starts to shut down. So when you regulate that, all of those things come back online. And so the answer is yes, 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 yes. Will it help with this? Yes. Will it help with that? Yes. Will it help with this? Yes. Because regulation in general does that. We even parasympathetic activity is, classified as rest and digest, right? Will it help sleep? Yes. Will it help digestion? Yes. Will it help these things? Yes. Because if you get the overall principle of we're regulating nervous system activity to be in a state of calm and parasympathetic activation versus sympathetic activation in real time, everything that's associated with that will improve. And that includes learning. And that includes, attention and things like that when we're moving people down off of their stress switch. And in terms, there was a question about primitive reflex and things like that. That sounds like an occupational therapy question, and I don't have an OT background. But the primitive, so what the brain and how it's connected, this is a complicated answer, but the brain and how it's connected is that if we are stressed out, we lose the ability developmentally. If we're stressed out developmentally, those things are going to be delayed. So if we regulate a child in early developmental stages, then those natural and normal developmental stages are more likely to be able to come back online and start developing normally. So originally, when I started doing work with bilateral stimulation, my aim was to get into the foster care system and things, because the ACEs, if you know the adverse childhood experiences score of traumatic childhoods and how severe they are linked to health outcomes, death outcomes, all of those things. But it's really because we're dealing with a dysregulated system. So if we can have a tool to add within people's developments, even if they're going through terrible circumstances, their systems are able to regulate throughout their development. I think we can get a kid with an ACEs score of 9 to end up with outcomes, looking like a kid with an ACEs score of 3 or 4. And so you're thinking along those lines, and I think it really could make a big difference.
I'll speak a little to this as well, just anecdotally. Prior to starting Dharma Doctor, I worked as an educator in alternative education environments. So I taught at a school for pregnant and parenting teens, and did GED outreach for one of our local community colleges. This was a space that was very near and dear to my heart. And part of the guiding vision of building Dharma Doctor was to make a tool that could be utilized in these non-clinical environments as well, for learning readiness, academic and behavioral challenges, etc. That was one of the guiding visions of Dharma Doctor. And so as we continue to grow and have resources, we do plan to expand efficacy research into those spaces. Of course, efficacy research, it's a balance of what resources we have available, but it's deeply aligned with our mission. So in the long term, yes, for sure.
All right, and I just wanted to loop back to Joey's question because he dropped another comment in the chat. I think what he was referring to is if somebody is using the app while in a telehealth session, like another video telehealth session on the same device, would having the tabs app open function during the session? Does that make sense? I think that's what he's trying to say.
Yeah, it should. It should be able to function in the background. If it's not functioning in the background, please let us know. That's a bug that we're still exploring. And when we launch a product, there's always unintended bugs on different devices. The first week that we put out the tabs, we were used on 57 different phones for the first time. So that was, it's difficult for us to preempt all of these different arrangements on all of the different phones. However, it should work in the background. So
I think also there are video software apps for, like things moving for eye movements. And so if you have the tabs and you have a separate app that has eye movements, how does that work? And you need the tabs to be coordinated with the movement on the app. And so I'm not sure how you would do that with two apps. And so the way that we get around that is having them not use like what we call smooth pursuit, apps, but just looking to the tabs as they're blinking, rather than viewing something separately. Because if they're out of sync, right? So if your eyes are over here and the tab's blinking over here, or if your eyes are over here and then the tab blinks off sync, you're not going to get the same result as if your eye movements and the bilateral tactile stimulation is synchronized. And hopefully we covered it for you, Joey.
All right, let's see here. We also have, are there any presenting issues with clients that you would not recommend using the tabs with? Are there diagnoses with which they have not shown improvement? That's from Jill.
So this is really about the sensory reactivity in the tabs. So everyone has a nervous system. Everyone has a salience network. Everybody is designed pretty much the same way, even though some can be, more functional than others and things like that. Okay. So we want to get away from saying like, doing these discrete categories of diagnosis. And we want to think of people as human beings with functioning neurology and systems. And we are helping regulate those systems within a person. And then it has specific effects. So some people may have an abreaction to the sensory nature of this. If someone has extreme sensory reactivity to, like in the case of severe autism, for example, or severe trauma and severe sensory reactivity. But there are ways to introduce any sensory input in kind of a kind, gentle way where it's very, in that case, if I had somebody with extreme autism, for example, I would use the app. Normally, I just use the pre-programmed settings, but I would use the app very, very low setting and low intensity. And then I would kind of scallop it up to get somebody used to it. It's kind of like, we're not going to take someone with autism into a loud movie theater. It would be like putting them into a theater and like slowly turning up the volume. And then we're at a good volume. And really we use the tabs to help people tolerate other kinds of stimulation. So in our clinics, we're doing EEG and we're doing neurofeedback. We also do cranial electric stimulation and different things. And those things have more abreactions. So we actually add the tabs when we're introducing something like that and when we're using it to help people tolerate it. Because again, once you get over just the first sensation of it, unless you have an abreaction, it's calming you down right away. So very, very few people we've not been able to use this with.
All right. And our next question is, any research around the use of tabs with patients with an ASD diagnosis?
Yes. So there was a study in the UK done. It was really great behavioral study. I love behavioral analysts, right? Because they look at every single behavior and they're coding it. And they found over a 70% reduction in what we call fight or flight behaviors in a week. So they had a control group where the kids in the school for 1 week did not have, they had a sham condition. And then the following week, they had an active condition of bilateral stimulation. And they found over 70%, I think it was 77% reduction in fight or flight behavior. So one child, for example, would bang his head on the table. And I think it was about 180 times in the control group week. And then it was less than 20 times the following week. And then kids, running out of the classroom or stimming, or doing what they would consider fight or flight behaviors. Huge reduction. And before I developed wireless bilateral devices, we actually used to have the wire devices. If people remember the Neurotech devices, they're not on the market anymore. And we would put them in kids with autism. We put them in their hip packs, and then we put them in their pockets and just have them run all day. Terrible for the environment. I'm sorry. They ran at 9-volt batteries. They ran a 9-volt battery out about every 6 hours. But the teachers could actually tell when the batteries would run out, because after a few minutes of having them run out, the kids would start stimming again, or they would start their fight or flight behaviors. But while the bilateral stimulation was on, they were getting this stress response. They were making eye contact. They were learning more efficiently. I mean, it was really profound. And it does make sense because kids with autism, or anyone with autism, their sensory network is very dysregulated. And that's the network that controls the stress switch. So it's a really profound difference in this particular population. And we've got kids with ASD and adults with ASD being able to go into environments and live different lives with these on. So one of them had a favorite mall that they would go to, and they wanted to go every day. They installed some kind of a water feature in with a loud sound. And then this child could not go in because of that reaction. But then with bilateral stimulation, regulating the nervous system, was able to go and then do his favorite activity again. So really can open up the world for kids with ASD when they don't have to have these reactions to their normal sensory environment. It's really cool.
To kind of piggyback on that, we have another question from Brianna. Is there data yet on the efficacy of these tabs or tactile BLS in general in clients who have an overactive parasympathetic response or physiological traits of PNS, such as low heart rate and bradycardia?
So that's a question that I don't have a complete answer to. So there's a little bit, we sometimes think of things as being extreme parasympathetic, is actually not, that's not maybe totally the mechanism. It's actually a deep freeze response, and it's different, or there's other issues with it. So I don't think that there would be abreactions to that, but I have not personally studied that, that in and of itself. But I do maybe have a little bit of question on whether or not the mechanism of that is really what it is. And if I'm right, then these should help tremendously. And if I'm wrong, then they may not have much of an effect on that in particular.
All right, Brad, did you want to speak to battery life real quick, and then we'll close out? It looks like we're getting pretty close to time.
Sure. Yeah, the continual battery life is about 2 hours of starting them and just running them on high intensity, high speed. If you do some of the lower intensities, it'll go up to 3 hours of just one charge on the tabs. And we have roughly 2 to 2.5 charges inside the case of the full tabs. We're going to continue to improve the battery in the charging performance. That's one of the places that we found that there's opportunity for improvement in this beta set or in these early versions. So that's something that we'll continue to work on, but they last quite some time on an initial charge, and with the case. And there was one other question that I just saw in the chat that I just tapped really quickly. Somebody asked about the sound of the tabs, or like the buzzing sound of the tappers make. And I don't know if you're referring to actually the Dharma Doctor tabs or a competitor. These are fairly quiet compared to all of the other tappers on the market. The Dharma Doctor tabs are substantially quieter. That being said, there isn't a way to make them much quieter than we have them currently. It's in the product design. As we build out version 2 and things, sound is always something that we're going to try and prioritize for. So we will continue to do that, but that's kind of the state of affairs. However, yeah, compared to all of the other tappers on the market, we are by far the quietest. Just as a comparison. But
and that's really important, because when you're using them and other people are around, they're not perceiving the sound of the Dharma Doctors. But if you're using some other devices around, other people can hear them. And when other people can hear them and they're not getting the actual tactile stimulation, it actually can tick up their stress switch, which is interesting. So sound is very important.
Okay.
All right. Well, I guess we're going to go ahead and close out. But I also just wanted to mention there are several of you in the chat that have asked about client codes. Yes, we would be happy to set you up. You can either email us at partnerships@dharmadoctor.com, or you can email me directly at michael@dharmadoctor.com. And that's MICHAL. Several of you have also dropped your email, so I'll do my best to reach out to you directly. But if for some reason you don't hear from me, maybe there's a typo after you jump off, please email me directly.
Thank you all for joining us. Hope you have a wonderful day.
Take care. Bye-bye.
Bye-bye.